I had a vitrectomy for complete vitreous detachment floaters in 2024. Hi. So over the past 2 years, I've now had 4 eye surgeries. And I had perfect 20/20 vision, close-up, intermediate, and distance before that happened. I'm in my early 60s, and one day I noticed a small floater dead center in my vision. And I'm a photographer and a hiker, and it bothered the heck out of me. So I went and had laser treatment, which caused my cataract to grow super fast. And everything went downhill after that. I have 4 or 5 videos, watch and see. I'll link them at the end. This is my second vitrectomy total. I've had 1 in each eye. And this is just for floaters for a vitreous full detachment. My surgeon puts his initials above the eye for operation and does multiple checks to make certain you are getting the correct surgery on the correct eye. Then you're given lots of numbing drops and dilating drops. Just look at how big my pupil got. Okay, I'm here at the hospital. I just had my second vitrectomy. As many people have stated previously, second surgeries are usually more painful, and I did experience a lot more pokey, pinchy kind of feelings with the tools going in and out of my eyes and the shots to numb it. My procedure supposedly went great. I got this cool pillow. I don't know what for yet. And yeah, the verse had kind of wore off already. And I got propofol, so I don't remember some of it. But I do remember it was a little more painful. My eyes real itchy. I don't know why. So that's the update right now. I am minutes out of surgery. There's all my stuff. Peace out. So my eye's a little itchy inside, and that didn't happen last time. And I'm glad they put the patch on because I want to scratch that thing. And I'm having a delicious saltine cracker right now. And I have a new hat. That's it. Hey everybody. As you can see, I'm 1 day post-op from vitrectomy. My first eye was done last summer, and that was because of a catastrophe with my cataract surgery. So you can look back. I have a couple of videos about my eye surgeries and my other vitrectomy, and I'll link those at the end, and you can watch those if you want more info. But here I am. I had my eye dilated. I was checked by the doc. Everything went beautiful. No worries. If you have any questions, put them in the comments. I'm happy to tell you how everything went, and I will give you some tips in a minute. Yeah, if you're really phobic, they can knock you out. They give you a little Versed first, which kind of feels like a cocktail, and that can prevent some memory. So it's like a short-term memory killer. So you may be talking while it's going on, and then when you come back, you won't remember. But if it hurts you, speak up. You'll be draped and all that stuff. They cover your whole face. They put oxygen on you, and then they cover you and they wash your face with betadine, which is kind of yellow. And if it hurts, say, ow, I feel that. And then all of a sudden, you'll be gone. They can put that propofol in. The last time I had fentanyl because it was a more inflammatory kind of situation. So yeah, that's some advice and tips there. So this time, besides the block, which is like a lidocaine numbing medicine, just like you get at the dentist, I felt some poking and pinching, and they knocked me down with propofol. And I don't remember much after that until I woke up. They titrate that. It knocks you completely out. They use that for colonoscopies. One nice thing about propofol, if your anesthesiologist uses it, is it also helps prevent nausea for some reason. So that's cool. I wasn't nauseous after. I never really am. It's an odd thing. Unless I take something by mouth that's a narcotic, which I prefer not to. I think a Tylenol just works fine for most procedures. So as you can see, I'm taking it easy. I took it easy yesterday. Typically, you have a patch on your eye for the first 24 hours. See your doc the next morning and start your drops. I have 2 drops, an antibiotic and a steroid. The first week, 4 times a day. And for that first week, you will cover your eye at night when you sleep by taping a clear plastic shield over it. Second week, the antibiotic is stopped. The steroids are 3 times a day. The next week, 2 times. The last week, 1 time. So after 4 weeks, I'm done with the drops. Easy peasy, right? I set a little reminder on my tablet and phone, which are hooked up. So whatever I'm using or near me, it pops up at the time I'm supposed to put the drops in. The steroid is a milky-looking liquid, and you have to shake that one up. So I had a subtenons block. That's the needle that goes behind your eye into a little space, and they put like lidocaine in there to numb you. And that lasted about 6 hours. When I got home, I popped a couple Tylenol just to be safe for when that wore off. Never had any pain. Sure, a few picky little things, or it feels like maybe an eyelash is in there, or maybe a little burning when you do drops, things like that. Don't worry about that. I had a lot of weeping the first night. Even though I had the patch on and the tape, my eyes would tear. It wasn't blood. It was just clear liquid. That was normal. That happened the first time. Weepy, weepy. Just get a Kleenex and dab. My eye's still a little weepy. So how's my vision? Blurry. But the other eye is compensating, and a little bit of fighting between the two for focus because it's not the same as it used to be. But hopefully over the coming days, that's going to sharpen up. Depth perception comes right back when they pull the patch off, so that's good news. Should be able to drive in a couple days. Doc said I could right away if I felt comfortable. No lifting, no big exercises where your heart rate's raised for a week. You want to keep the pressure low. Post-op appointment 1, the pressure was 10. So that's really good. Nothing bad going on. He looked at my eye, checked the retina. It's all, on there real nice, so no worries. This was a simple pars plana vitrectomy for floaters, so less serious than the one I had previously. The one I had previously, the trocars, there were 3 of them, fit a vitrector that was a 23 gauge, which is much bigger. Need a bigger hole for it because I had chunks of lens in my eye. This time just for floaters, 27 gauge, half the width and diameter, much smaller little holes. Not any kind of floater, black dots. It's crystal clear in there, except for the fact that I'm a little swollen, so it's still fuzzy. I'm feeling good. These are just readers. I like to wear something to protect the eye from impact. I have a pet parrot who can cause trouble, coming over and wanting to kiss me and whatnot. I have those wraparound glasses for outside that have UV protection from my light adjustable lens, IOL. So I wear those outside, which is really nice. If I take any hikes in the woods, they'll protect my eye completely. First night home, I had a little egg sandwich, lutein and eggs. That's really great for your eye. I had some mega antioxidant juice. Later in the evening, I had a little bone broth with ramen noodles. So I ate really light, nothing heavy, and just laid around on my butt. And today it's going to be the same. After that, I'll be up and around a little bit more. We had the surgery the day before Thanksgiving. So today is Thanksgiving, and we put that feasting off till tomorrow. And I won't drink. There's a get-together on Sunday where I might have some imbibing, some adult bevs. By then my immune system and eye should be better. So when you have surgery, typically there's nothing by mouth after midnight, except for maybe a few sips of water in the morning if you have any other medications that you take. I like to load up on water at about 10 o'clock and have a light carbohydrate snack and then go to bed and get a good night's sleep. My surgery, I had to be there at 7:15 in the morning, so I was up at 5. So it was an early morning for me, but got it done. I had a full day of rest, and I still feel pretty tired today. When you sleep all day, when you come home and you're on the whatever happy juice they give you, then at night you kind of toss and turn. So there's that. Parting thoughts in closing. It's a relatively easy procedure according to my doctor. Get a retinal specialist, someone who does this all the time. Get the most experienced one you can, and then follow that doctor's specific advice for you based on your medical history. Take the drops the way the doc prescribes. Don't miss any. Take care of your eye, protect your eye, rest, and it should be an easy procedure. I wish you all the best of luck. Don't be afraid of vitrectomy. It's virtually pain-free. and a quick recovery. Good luck.